You may begin by calling the number provided and enter when you are ready. You may begin by calling the number provided and enter when you are ready.
Good morning.
Good morning.
Hi, I'm Dr. Auerbach. I'm one of the attendings on the team, and I saw you a couple of days ago. I wanted to talk to you today. Just before starting, I'd like to verify your name and your date of birth.
So my name is Naomi Schmidt, and I was born on July 31st, 1978.
So I wasn't here yesterday, but I wanted to come to talk to you today. How have you been feeling?
I'm really worried about this thing from last morning, this ringing in my ears. What's going on?
Okay, well, I'm going to get back to the ringing in a couple of minutes, but first I wanted to know how you're feeling otherwise. Do you have any pain?
No, not really. The pain that I came with subsided. It doesn't bother me anymore, and I'm a lot better than since I came.
It's great. That's reassuring. I'm glad that you're feeling better. I'm just looking at your blood tests here. So we had you on a few different antibiotics for your kidney infection, and I wanted to tell you that we made an error in the dosing of one of the two antibiotics. It's called gentamicin. You should have been receiving it every 24 hours, every 48 hours, but you were receiving it every 24 hours.
You're joking. I came to the hospital and I've been overdosed with this medication, and I'm left with this ringing in the ears, and all is because someone made a mistake? Is that what I'm hearing from you? Because this shouldn't happen in the hospital. I shouldn't get worse in the hospital. I should get better. I never had this. This is really annoying.
Yes, so it is too much antibiotics, and I do believe it's the cause, probably the cause of the ringing of in your ears, and I can see you're very upset, Ms.
Yeah.
Schmidt-Affect, and rightly so.
Yes, I'm very angry.
I can only say on behalf of the department that we are very sorry.
Well, sorry is not good enough, and it's not the department. It's someone who made this mistake. Do we know who made it?
Well, as of right now, we don't. But the department takes these kind of errors very carefully. And when it happens, we look into all the systems to see what went wrong and how we can minimize it in the future.
Yeah, but it's one person who either written it wrong or given it wrongly. Do you know who this person is?
No, sorry, not at this moment.
Can you find out who this person is?
We can, but what would you like them to do?
I would like this person to come personally to me and apologize. Will that happen?
I can't guarantee that this would happen. As I said before, in these kind of cases, the department takes responsibility, and I'm here to offer an apology on behalf of the individual who made the error.
Yeah, that's what always happens. You all cover each other's back and put a wall around yourself. I'm going to complain about it. I'm going to make a complaint, make no doubt about it. I will sue you.
Well, I wanted to tell you a few things. We will not stop you from making a complaint. There's a formal process, and I will give you the name of the person to send your complaint to.
Good. So how long this thing is going to last?
I don't actually know. I'll ask my senior colleagues, and I will get back to you on that.
Is there anybody in this place who knows something? A supervisor? They have given me a dosage that shouldn't be given, and then sitting here you can't answer my question. Is anybody who knows what's going on? You need to show me empathy.
I'm really sorry about that this happened to you.
I'm going to make a complaint, and I want financial compensation.
Okay, but in that point in particular, we don't deal with that ourselves. However, as I mentioned, we do have a person who's going to take your complaint. They'll get your medical record and your forms, and this department will give you some information about compensation. Now, I'd like to pause. These things are, of course, in your right to do. But at this moment, there are a few things that I'd like to do to make sure you're safe going forward. So we've stopped the antibiotic, and it continued the other. But it looks like your kidney infection is much better. So very soon we can switch you to an oral antibiotic by mouth. And then with this gentamicin, we know that this is a side effect, but we checked the level in your blood today, and it is the right level.
So you stopped it now, yeah?
Yes.
Okay. So infection is better, but you left me with this thing.
Yes.
Great job.
So we spoke about what happens now. I also want to let you know this. The department will make a report. We will involve the senior doctor and the nurse in charge, and there's a formal report process. At this point, we'd like to minimize the chances that this would happen to anybody else. Okay? Now, you were going to ask how to make a complaint. So I will help you and contact the patient care representative, and they'll be your contact for this. Okay?
And they will do the investigation. They will be able to tell me what happened.
Yes, they will analyze the incident, and you can discuss compensation with them.
Yeah, well, right. People will probably cover up. Yeah.
No, I don't know.
The people involved, will they tell the truth?
Yes. And the last thing is, once we confirm the harm from the antibiotic, and I appreciate that it's there, we will refer you on discharge for a hearing assessment. We feel this is important.
And it's a bit too late, isn't it?
I understand what you mean, but we believe it is important to see the degree of impairment. And also, the audiology team will be able to advise you on how to manage your impairment and some coping strategies for dealing with it.
So I'm supposed to go to this patient representative, and I don't want anybody to cover up. I want you all to tell the truth.
Absolutely. We will be transparent as we need to be and to provide all the information for you. I'll give you some space now, but if you want to meet again and discuss more with me or my other colleagues, feel free to call us. The nurse has the number.
I will, don't worry about that.
Thank you, and I'm sorry. No, I'm sorry, Mike. We have time, actually.
Yeah, you can stop that.